Let's bring in Dr. Justin Skrynski. He's with Beaumont Hospital. Good doc, great to have you with us here.
Good morning. It's a pleasure to be here.
So give us the latest update. I know that Beaumont Health is now allowing more visitors, but it's also, we have to keep that in mind to the perspective of what's going on in the community.
Yeah, exactly. So fortunately, our census is down at the hospital. And just like you said, that reflects what's going on largely in the area and in the state, and fortunately nationwide as well. So there's a couple reasons we can get into later in terms of why those numbers are looking better. One of the things we always want to emphasize is a huge thank you to the community, because a huge part of why this is becoming under control is the enormous sacrifice and all the hard work that everyone out there is doing in terms of masks, distancing, staying home, and just being smart in general.
But also a huge thank you to you and members of your team, because this has to be exhausting. We're like 11 months into this. How are you and the employees over at Beaumont holding up during this?
It is exhausting, and thank you for saying that. Everyone's holding up, and again, I think the vaccine was a big turning point for us because, you just feel like you're locked in this endless cycle of, all right, well, we have our lockdowns and cases are under control, and we start opening up and cases surge, and then just sort of rinse, repeat. And now finally you have this sort of off ramp to all of that in terms of the vaccine. So morale is much better. Seeing the cases here decrease is much better. Still the same disease. Unfortunately, we are still seeing the same severity of cases, just not as many of them. So it's still a real thing and it's not over, but much, much better than it was, let's say, going back to November.
Yeah, 11 months into this, and I think we've all known several people that have been impacted by COVID-19. But when we hear these numbers about ICU and ICU beds, can you give us a perspective from within the hospital walls? How many beds are typically assigned to a hospital?
Well, Beaumont's, I'm here at Royal Oak. So I can speak for our campus at least, and we have a very large ICU capacity. We've got, our entire East Tower, which is 5 floors, is devoted to intensive care, and that's split between all the different specialties without going too much into specifics. So we have a very large ICU capacity, dozens of beds. You go to some of the smaller areas, and they might even have a couple beds or not at all. So in our case, fortunately, we've been able to absorb a lot of that capacity. And even though it got tight at points, especially during the kind of 2 peaks in cases that we had, fortunately, we never ran out of ventilators. We never ran out of ICU space. And again, now that cases are declining, we certainly have a lot more to spare. I think all of us are still a bit shy about what happened before, so we're keeping a lot in reserve in terms of having that available if needed.
I will say one of the biggest things I missed about Beaumont and what you guys do is your sweet dreams for, the kids. And I do know that they try to do it virtual this year, but that is one of the best events that you put on for the public. Not best events. You save lives every day, but it's such a sweet event.
Yeah, it really is. And it's just kind of wrapped up in the entire tragedy of the pandemic that we're not able to do things like that. As much as we'd want to, it's just, we can't encourage gatherings like that. It breaks all of our hearts. We here in the medical community, we feel it just as hard as everybody else. We're just people like everybody else. We all hate masks. We all hate having to stay home. But it's just a matter of trying to get through it together.
Well, and now that you did bring up the issue of mask, let's talk about that. Now we're hearing it's not only necessarily one mask, but maybe you need 2 masks.
Yeah. So the key word is layers. And that's if you, let's say, look at the CDC guidance that we're getting right now. One of the things they're recommending is layers. So, for instance, I got my little show and tell here. So this is just a regular cloth mask. But a couple layers of material, and that's one of the important things. Now, the problem is a mask like this got its upsides, it's comfortable to wear, it's got a couple layers. It should be pretty good in terms of screening all the particles and droplets, but doesn't necessarily seal tightly. You've got a mask like this, which is one of our surgical masks. Again, it's got a couple layers of material to it. Also doesn't seal tightly. One of the new recommendations, which is exactly what you just mentioned, is to kind of combine these. So if you have a disposable mask underneath and then something like a tighter fitting cloth mask on top, that can help to seal the mask more tightly against your face, because again, you're trying to prevent all those particles from escaping. The main benefit still seems to be in terms of, again, catching all that's coming out of your mouth. That's why it's important everyone wears it. But also, if it seals tighter, that's going to provide more protection to you as well when you're out in public.
We have seen some of the masks change throughout this pandemic, or at least the ones that are being sold like at your gas stations and your grocery stores. And they're starting to come with like, it's basically molded so that you could push it around your nose. Is that really, you need that, right?
Yeah, absolutely, absolutely, and that's one of the benefits of the disposable mask, is that usually most of them have a little piece of metal that you can mold around your nose. Again, you're going to get a much tighter seal that way, and assuming you're breathing mostly through your nose, which you mostly do, you really want that tight seal around areas where air is going to otherwise be escaping. And again, that gets back to the idea of, okay, well, if you have a tighter fitting mask here, you've got another mask on top pushing it, especially around the sides close to your face. That's going to give you the best seal and the most protection.
So, doctor, with that, I will say, and I'm going to admit right here, I am more of a fan of the neck gaiters, because I don't know how many times I forgot a mask. So it's easy to throw them in my car and then put them on and put them up, pull them out. Those really aren't recommended.
Not recommended, but I think that's a really important point, to the extent that something's always better than nothing. So you see people out of the grocery store and they're wearing a bandana, or they've got a gaiter or a scarf. Again, not optimal, but definitely better than nothing. And it's still appreciate the effort. So yes, if you just have kind of your sort of daily kit, as it were, where you have something like, a good fitting mask available, or disposable masks, which are increasingly common, that's best to have on hand. But again, if it's between that and nothing, definitely. If it's between a gaiter and nothing, definitely wear the gaiter.
So, doctor, I have to say, though, I'm thinking about this because some of the people that are wearing a mask, so we're seeing it like on TV during the Super Bowl. There was a reporter and she was trying to talk through her mask. I was like, she sounds like the Peanuts teacher. And if you put two masks, I'm not going to understand you. So it's like two masks if you're not going to be talking to anyone.
Yeah, and I mean, I feel you on that one. I mean, I wear an N95 for a lot of the day too, and I think I still have my N95 lines here. But I mean, I lose my voice from shouting through that thing. So it's a pain, and again, nobody likes it. Even in the healthcare community, we're all sick of it. We don't like it. It's such a necessary evil, and especially for those people out there who are doing those frontline jobs. And I'm not just talking about healthcare workers, but all the frontline jobs. You're stuck wearing this all day, and yeah, it's a recipe for a sore throat.
You bring up a good point. I mean, for us, it's a minor inconvenience, but for people such as yourself that are working each and every day, it really is a life-saving measure.
It really is. It really is. And, again, if you look at all, it's so dramatic, it really is. If you look at all the projections in terms of, because again, we're not out of it yet. And I certainly don't want to be doom and gloom, because we're doing a lot better than we were, but still not over. But if you project out over the next few months until we get most of the population vaccinated, how many lives you'd actually save just by universal masking, and you got to think, okay, each one of those, even if it's 100, even if it's 1,000, that's 1,000 people who could be here as opposed to not, if we just all wore masks. So it's still, so critical. And a lot of people say, well, we've got vaccines, why do we need masks? We've got treatments, which, that's another story. Why do we need masks? And the answer is because none of these things are 100% effective. And just the idea that such a simple thing can save lives.
But, some people argue too, well, the flu kills people, and we're not wearing a mask for that. And the good thing, though, I do think about this, the number of flu cases have been down this year.
Absolutely. Absolutely. And that's been a question that's come up a lot, is where's all the flu cases? And I think sometimes the implication is that flu is being, either unintentionally or intentionally misdiagnosed as COVID. But honestly, you got to think, okay, we're taking all of these measures to prevent against a contagious respiratory disease. And then you got to think, okay, well, all the other contagious respiratory diseases are going to decrease as well. So one of the silver linings is that flu has gone way down. And honestly, you might see masks persisting on an elective basis, even if they're not mandatory. People might just be more aware and more concerned to the extent that during flu season, that might just be the thing that we do.
So a couple of questions for you. One, we were having the conversation at our Sunday dinner last night. I have it with my sister and my brother. For people that basically their family of circle, let's say, if they've all had COVID, are they okay to continue to hang out together?
Yeah, and that's it's a pretty multi-layered question. I mean, the short answer is probably yes. The official answer, you definitely want to, try and keep household interaction in terms of number of households together. You still want to try and minimize, if possible, you still want to distance, do masks. There's a lot of encouraging research right now coming out that's showing that the immunity that you form either after a COVID infection or after a vaccine is actually a lot longer lasting than we might have originally thought. And if you look at related illnesses such as SARS, so the sort of original SARS, not this CoV-2 that we're looking at, but the original SARS, we see that people actually have immunity lasting many, many years from that. So the new research is very encouraging to the extent that hopefully people who were infected and got vaccinated are going to have protection for years. Now, to get back to your question about mixing households and continuing to do that, it's dicey. Is the risk high? Certainly not. Is the risk zero? No. So, my thought is if that's already your pod, so to speak, and that's what you've been doing, I think it should be okay to continue.
Well, I will say my sister is my twin sister, and she's like, well, we shared a womb together, but she does always blame me for stealing her nutrition, and that's why she doesn't play tennis very well.
Well, hopefully you didn't. Yeah, hopefully you didn't share viruses though. That's the only thing you got to make sure of.
Exactly. So with that though, doctor, one of the big questions right now, we're really not focused on testing like we were prior to the vaccine. We know that before the vaccine came out, there was so much focus on testing, delayed results, but also the accuracy. How is that world? Have things changed? Have the testing results become a little bit more, let's say, reliable?
Yeah, so the testing technology has definitely improved. The PCR swabs, that's the one where, kind of go all the way back. Those were always, fairly accurate to the extent that they're not necessarily the most sensitive in terms of you can have false negatives, but they're very specific, meaning that you don't have any false positives. When those things light up positive, that means the virus is there. Some of the other tests, like the antigen testing, that's kind of mixed quality. Some of the antibody testing, that's kind of mixed quality as well. But you're absolutely right. And the focus has certainly shifted away from testing. And that's actually one of the things that some experts are saying might actually be contributing to the decline in recorded cases is the fact that everyone's very focused on the vaccine, rightfully so. But testing's now taken a back seat because now people are less likely to go out and get tested because they're thinking, well, if I've got minor symptoms, I'll wait it out at home and I'll just wait my turn for the vaccine.
Oh, well, and because if they do go get the test, right, and if they're going to think they have it, and even if they get the test and it comes back positive, they're not going to change anything they're doing because it is mild. So therefore, if they're going to kind of self-quarantine, which I feel like we're all kind of in this right now, but if we can talk about the antibody test. So what exactly is that process for people who have not had it? Because we are hearing like you can get it at some grocery stores and pharmacies, or should people actually go to their healthcare provider to get that test?
Right. So the antibody test, I think where it's done is not so much of an issue because usually they go to sort of the similar labs, but that's a blood test, and again, that's looking for the antibodies, so your own immune response against COVID. Now, that one of the things about that is it's good to know that you have them. So it's certainly good to know if you've had antibodies. that's definitely a marker that you've had COVID. So if you're concerned about the fact that you might have had a resolved infection, that'll certainly help you figure that one out. But the problem is that, first off, we can't verify if those antibodies are actually what we call neutralizing. So we can't verify that those are actually protective. So if you light up as having antibodies, that's not a free pass to say, well, I'm immune to COVID now, because that's not what that test looks for. It just says, hey, are there antibodies there? If the answer is yes, that test lights up positive. It's not saying they're functional. And then furthermore, especially now that we've got more variants popping up, it's not going to tell you whether or not you've got protection potentially against those variants either. So some pitfalls of antibody testing.
You're listening to 89.3 Lakes FM, 88.1 FM, The Biff. Dr. Justin Skrynski with us here. He is with Beaumont Hospital, and listening to you say this, it kind of goes back to the beginning of this. Still a lot to learn about this virus.
Yeah, still a lot to learn, and absolutely, it's not like we were at the beginning. I'll tell you that much. We've got a lot more information than we had at the beginning, as you said. Lots of questions, but just because we have variants circulating now, just because you hear about things like B117 and B1351, that doesn't mean, okay, here we go again, back to the beginning. We've made a lot of progress, and these are all hurdles that we're gonna have to cross moving forward, but it does not mean that we're back to square one.
Is this going to be something that we are going to have a vaccine every single year, just like the flu shot?
That's an excellent question. And honestly, I couldn't tell you right now. My hope is that once you get a control of the pandemic, you're not gonna see it really circulate in the population, sort of persist in the population. You look at other diseases, and sometimes they have what's called an animal reservoir, meaning that outside of people, the virus can kind of hang out somewhere in the environment and then reinfect people. And right now, it doesn't really look that way with COVID necessarily. That's a whole nother story. But long story short is that it seems like COVID is in people. And so if we get it out of the population for the most part, or have large enough immunity, hopefully we'll just see that virus sort of die out in the community and not really be able to persist. But also, if you look at vaccines like I'm thinking of the Johnson & Johnson vaccine, the AstraZeneca vaccine, those don't necessarily prevent all the cases, but they do take away the severity. So that's another possibility too, is if you can basically turn this into another cold, then that's almost just as good as getting rid of it. So it could still persist, but it's just not really going to land anyone in serious trouble.
Dr. Skrynski with us here. He's with Beaumont Hospital. I will say I'm waiting for the Johnson & Johnson, because that's just one poke of the needle versus two pokes of the needle. And when we're seeing the video of so many people getting that vaccine, that needle looks really, really large. But when it comes to your patients and the general public, especially the ones that are hesitant to get the vaccine, what do you want to say to them?
Right. So I say go for it. There's if you have doubts, reach out to a doctor, reach out to a friend. I think right now, one of the benefits of social media, we saw so many, just with everything going on, it's so many kind of toxic effects from social media. But one of the benefits is that there are very few people out there who don't know someone or have a family member or close friend who hasn't gotten the vaccine and can share their experience. So what I say is definitely go for it. Yeah, the needle looks a little bit intimidating. I can say the nurse that gave me mine, she was a ninja. I didn't even feel it. It was crazy. But again, it's for the vast majority of people, there's no issues. If you do have concerns, if you're someone who's had bad allergic reactions, reach out to your doctor, talk to somebody who has some more information for you. The important thing is that you have to come to that determination yourself. Okay, don't just take my word for it. You have to make yourself comfortable with getting that vaccine. So educate yourself, know as much as you can, and make that determination on your own.
Yeah, and one thing we are hearing too is there are a lot of people that are getting the vaccine that maybe are on the front lines, and so they're in that percentage that they're allowed to get the vaccine right now. And what they're saying, a lot of people is like, I'm not getting the vaccine for me, I'm getting it for you. I'm getting it for us to be able to go back to life as we knew it. This is bigger than me. This is about our community.
Absolutely. And, again, you got to think, COVID's got to leap from person to person to person to person. And the more of those spots you take out of circulation, that's the few opportunities that this thing has to continue to circulate around in our society. And you look at all the variants that are forming, That's tricky because the longer this thing exists, the more chance it has to mutate, to change, to possibly dodge the immune response, to dodge the vaccine. So it's not just a matter of saying, okay, well, we got to make sure that people just don't get super sick from it. That's obviously step one, is to treat the people who are critically ill. But you can't just let it go indefinitely, because again, the more you let it go, the more it's going to potentially change.
Okay, so for those out there, just a couple more questions because I know you have to go, but I will say
Yeah.
anytime I can get a doctor on, because you guys are so much smarter than all of us, and plus you have the knowledge. So I'm asking the questions that I hear from some of the people that I know in our conversations. And of course, the conversation always comes back to herd immunity. And why not just let the people that are immune compromised be the ones that are in quarantine or self-isolating while the rest of the world goes about its business? Because wouldn't you get to herd immunity sooner?
Yeah, I mean, the response I would have to that is you can definitely strive for herd immunity, but at what cost? And right now in this country, again, one of the there's a few reasons why people think things might be slowing down. One of them is we might be approaching a degree of herd immunity, especially in really hard hit areas. I'm thinking of LA, for instance. But what's the cost of that? So you can reach herd immunity, but we've already lost 500,000 people. So you could certainly let it go and say, well, we're just going to let it burn through. We'll get herd immunity. We will be done with it. But what's the cost of that? And right now, COVID, when you treat it, if you end up in the hospital and it's treated, yeah, mortality is very low. But if it's not treated, you end up in a situation like you had in Italy a year ago, where it's 10% mortality, where it's 1 in 10 people could die from it. So, I think herd immunity in that sense is best accomplished by vaccinating, because it's once you get enough vaccines out there, it's the same phenomenon where, again, person to person, there just aren't enough susceptible people for this virus to keep jumping around.
I will say I can't wait to be able to hug people again.
Absolutely. There's so many things that I miss. And I mean, honestly, it's been a year. And I mean, like last year, early last year, I think about January 2020, it just seems like a dream at this point,
It really does. Good doctor, we so appreciate your time. But before I let you go, anything maybe that we didn't touch on that you want to add?
I mean, just to the extent that, again, just hang in there. It's, this is not one of those here we go again situations. We're making great progress. We're not out of it yet, but we definitely have an out now, and everyone's doing a great job. Don't get tired, just keep going. And I think we'll have an answer soon.
Great words of advice for us, because you don't have the option of giving up and being frustrated. You still have to continue to do your job every day. And if anything, we need to support people such as yourself. Good Dr. Justin Skrynski with us. He is with Beaumont Hospital. We so appreciate your time.
My pleasure. Thank you for having me.